Good day to you. Today we are going to look at the module LWET 101 that's pertaining to the legal and ethical environment in healthcare services. This is a very important module which every healthcare professional should know the content and the concepts and then implementation of them when they work in a healthcare environment. If you look at it, this particular module is focused on few diploma programs in general nursing, physiotherapy, and biomedical sciences. If you look at the outcomes of the module, that would cover the practice within the legal frameworks, which governs in nursing, physiotherapy, and biomedical sciences, to apply ethical concepts in clinical practice, to support rights, interest, and needs of the clients and the families, and supportive reflective practice. Those are the outcomes of the module. And if you look at the topics that we are going to cover, the introduction, this particular module, then we will cover the ethics and the law, the organizational standard, the clinical standards, the professional standards, and then the bit of touch on forensic medicine. Today, this particular program is mostly delivered in a collaborative learning mode, and then most of the students will have to really work on their own most of the time. This lecture series would guide and facilitate them in order to be a successful candidate of this particular module. So, the healthcare is considered as a regulated industry. It is now, if you pass an exam and get a degree, it doesn't allow you to practice in a healthcare environment. You need a registration to practice. This has been there for so many years now, centuries and centuries. Simply, then we ask a question: why you want to control healthcare services? If you really look at the human body, the human body is the best ever system have been ever created, and it's balanced. There's input and output. If you drink something, you have urine, a fair amount, etc., etc. So there's a very balanced body system. This particular body system is maintained by highly internal controls. So the internal controls will make sure the body is well balanced. But there are many other external factors, dynamic environment, external factors are changing the body response. So they could be physical, chemical, psychological, and biological changes happening in the body in order to balance the body systems. But sometimes the balance might go haywire, or we call it an imbalanced body system. Then we call this person a sick, or is a health condition, or a disease, or an illness. So what happens is we try to, in our healthcare environment, what we try to do to convert this sick person to a well person, or getting better of the disease. So it's called, we call it as we do healthcare interventions. Healthcare intervention. The healthcare interventions are the ones that we do physically, we do surgery, or medically by using chemicals or drugs, or psychologically giving psychological advices, drugs, or lifestyle changes if you have a problem causing due to lifestyle changes. So these are called healthcare interventions. So when we implement healthcare interventions, now not all would respond equally, because same patient can respond to a same drug in different times indifferently. Not only the patient itself, they can become allergic to or low response to a drug, but also the staff. Staff could working in a very highly fragile environment, a very frugal environment. So therefore, their mood could change. There may be negligence happening from them, or other hospital organizational issues like improper services, equipment can be broken, and some of the supplies are not may not be good as it seems. So all these things could change our intervention also. So these interventions are not predictable. We can 100% sure when you go inside the hospital or healthcare center, you get out of the healthcare center being a well person. There will be so many things can happen. So therefore, we call it as healthcare services as highly unpredictable environment. So there's high probability of changes, as I told you before. In other words, there's no black or there's no white area like in the other services. If you walk into a hotel, you have your services are very distinctively determined, and you can either go to the pool, you can go to a canteen, cafeteria. You know what you're getting. But in healthcare, it's extremely difficult to predict what's going to happen to you. So therefore, it's always gray. It's not black and white. Because of these gray areas, we'll have to really look at controlling this gray area by different means. So that will stop the conflicts happening, issues happening, mishaps that could cause by us to the patient. So please watch these videos one by one. That will give you the insight to the area, introduction to this area of a legal and ethical environment. So the other question is, can we consider healthcare services, healthcare as a service? Can we? That's one of the other question that we could ask. Yes, you can, but on the other hand, you can argue, no, it's no. Why? So what's the difference between humans and animals? Because humans and animals, if you take them, animals always has their needs. When they are hungry, they will eat something. But humans, they need a choice. They need a choice. They need not only a meal, but they are specific ones. So if you really look at human needs, so essential need of the hour is a need, and then somebody would say, I'm hungry and I need a meal. Even for animals, that's exactly what's happening. But in humans, they prefer what they want to eat. For example, I want a hamburger, not only hamburger, with cheese and ham. So the needs and wants are the ones that really confuse the healthcare sector, simply because we cannot address all the time the wants, but generally as healthcare professional, we address their need. We try to address their wants, but a patient does not know what they really want. So with that mindset, if we really want to control this healthcare, so there's ethics that we cover. We talk about it in a while. Law and civil law, the client rights, that's another big area. And then professional standards or the nursing boards, nurse-patient relationships, another big area, big chunk. Then organization, a hospital or the healthcare environment, they have separate control systems. And when you actually try to do the healthcare intervention, then there are clinical standards. So these are the 5 areas to control unpredictability of healthcare, that principles to control unpredictability of healthcare. So we have put these 5 areas, and for the next few lectures, we will try to see, we'll try to control how these factors are controlling healthcare services. Thank you.